some exciting new things happening here at VRC. We are moments away from starting a couple of new projects. And so I'm excited about that. But very importantly, we started our own PGT program. So now we do our PGT in-house. We don't need to send it out. We have a phenomenal lead in our genetics program. Definitely one of the smartest guys I've ever met. And Adam is in charge of doing our genetics part of things over there in the PGT, and also developing some very cool new testing that we will be doing here in Canada as a Canadian first, actually. So we're very excited about that too. So yeah, there's some up and coming things that are very exciting for us. Somebody else, by the way, yesterday messaged me going, is your building expanding? So some real estate agent had got a hold of our model, our plans for the expansion, and had put it on his thing saying expanded access to care. So very cool that it's out there now, but I can release that we will be adding about 12,000 square feet to VRC. So yeah, we're putting on a second level and we're bringing in more doctors, hopefully, and a lot more services. So very excited about the expansion. The lab is going to double in size, and yeah, very exciting stuff happening coming up soon. So tonight we are not presenting a paper because there's really nothing to present. That was good. I scoured the recent articles and I couldn't find a single one that was even remotely interesting, unfortunately. So we're going to take questions tonight. So Tarek is here to ask the questions.
We got a lot of questions.
Okay.
That's the good news.
That's the good news.
Bad news.
Yeah.
Is we got a lot of questions, so we might not get through all
every
of them.
single one.
That's right.
Yeah, and don't ask on multiple platforms, please.
It's cheating.
It's cheating. Yeah, no cheating.
Never prospers.
Yeah, there you go.
All right. Question number 1.
Yeah.
You mentioned to avoid high dose stims for endo patients because it fries the eggs.
Yeah.
So, what is an ideal dose if many per 150, Gonal-f 375 are considered too high? Well, part 2, same person.
Yeah.
How much time do you recommend in between stimulation cycles for an endo patient, 42 years old? Are back-to-back stims okay, or is it better to have time in between?
Okay, so as far as what's the maximum dose, studies have very clearly shown that once you're going over 300, sort of 375, there is no benefit whatsoever. So there are head-to-head comparisons between doses of 600, doses of 450 and 300, and there's no difference. So we max out at 375. There's the rare instance where I'll go maximum 450, but I hear every day about people that are taking mega doses of meds and they're useless. So please, for the love of God, don't do that. There's no benefit to you doing that. Are we having TikTok volume problems?
They're mentioning something, but everything seems to register.
So I don't suggest or recommend in any capacity that people go over a total of 375. So for example, you're doing Gonal-f and Menopur. It's a combination I use all the time. It's kind of our go-to. We would max out at 225 Gonal-f and 150 Menopur. That's the maximum that we would use. If you're thinking of doing this with, for example, Recavel in Canada, we would do maximum 15 of Recavel, 150 of Menopur, which is roughly the same equivalent of 225 of Gonal-f. So that's what we do in our program. And we try to stay more around the 300 range, but I'm reasonable about it. I'll go a tiny bit higher. Once you go beyond that, you're doing nothing. You're charging patients a whole lot of money to fry their eggs, which is really great for making money as a fertility company, but is useless for the patient. It's literally depriving them of their egg quality and their finances. Like it's actually cruel. So why anyone would do that is beyond me. From the standpoint of back-to-back, there is no data to support specifically in endo patients that spacing it out versus going back-to-back is going to make any difference at all. So there's nothing wrong with going back-to-back. I will say that from the standpoint of doing duo-stim, we find that if you split the duo-stim into 2 separate cycles, you get more eggs rather than doing the original duo-stim, which is follicular phase in October and then luteal phase in October. We actually do follicular phase. Let's say you start your period on 1st of October. We would be doing your egg retrieval around, let's say, the 13th, 14th of October. And then we would be doing your luteal phase retrieval like kind of end of November, because you would have your next period in November or end of October. You would wait for the luteal phase. You would stim for probably 12 to 14 days because they are a little bit of a longer stim. And then you're retrieving again. We get more eggs when we do it that way. So we've coined that as split duostim, and it seems to work a lot better. But it doesn't make a difference if you're endo or non-endo for that. It'll work for anyone. Did we fix the sound
I think
problem?
maybe it's your mic, the way it's because in there usually sounds so deep in there. Yeah.
How's that, everybody? Is that any better?
It's just the TikToker. So if TikTokers can let us know if the sound's better.
Let us know, TikTok, if we're better, or am I on the wrong station or whatever.
You're on the right station. Station looks good.
I also have the fuzzy wuzzy one in my my drawer.
I think it was just underneath the clothing.
Next question.
Yeah, next question. Hi, doctors. Are there any studies which connect iron infusions with side effects for endo patients?
Not that I'm aware of. We know that endo eats up a lot of iron because your bleeding's heavier. There's hemosiderin deposits, which is iron-based. So we know there's dysregulation of iron in endo patients, but I'm not aware of anything that says the infusion compromises in any way your endometriosis. I would be happy to look it up, though. Does iron infusion compromise patients with endometriosis?
A quick question we got from TikTok is, do you take patients from other states?
I take patients from all states, all countries. We don't restrict people from anywhere. You can come to us from anywhere in the world. Is it working better now?
No complaints.
No complaints? All right. Let's see about this. It says, while iron infusion, oh, here you go. While iron infusion can correct iron deficiency in endometriosis patients, which is common, excess iron may worsen endometriosis related pathology and infertility. So women with endometriosis are a significantly higher risk of iron deficiency, which I mentioned, often due to heavy menstrual bleeding and chronic inflammation. It's important, but iron overload, it says research shows that iron overload, whether from endogenous or excessive supplementation, can be harmful. So it can be iron overload in the pelvic cavity and follicular fluid is linked to increased oxidative stress, impaired oocyte quality, and infertility in endometriosis. Excess iron promotes granulosa cell ferroptosis, a form of cell death related to iron, disrupts oocyte maturation, and may worsen reproductive outcomes. In animal models, iron overload enhances the proliferation and migration of endometriotic lesions, potentially worsening disease progression. So don't overdo it, but you also don't want to be underdoing it because that's not good either. So that's very interesting. There you go. Great question.
Is it recommended to stop taking PQQ and or ALA once you have a confirmed pregnancy?
We don't. We keep people on it. I don't like changing things once you're pregnant. ALA, you certainly shouldn't stop. I'm less familiar with PQQ, but ALA you shouldn't stop because ALA actually can reduce miscarriages, we think, but it definitely reduces bleeding in pregnancy. So I don't stop my patients that are on ALA. We keep them on it.
Hey, Dr. V and Dr. T.
Oh, you love that.
This is good news.
Yeah, that's a good shirt, by the way.
You know what? I really fell in love with this dark blue shirt.
I like that shirt.
You know what?
That's a good shirt.
Me
man.
too. It became
Why didn't
my
you
favorite
tell me?
color.
I would have dressed up again.
I didn't know.
You're killing me, dude.
I would look so good in it. No, but it became a really good color.
It's a good color.
It's a good color.
It's a good look.
Feeling all this?
Yeah.
I'm feeling all that.
I just gestured to all of you.
Yeah. Hey, Dr. V and Dr. T, thought on red light therapy over the uterus ovaries during stims for retrieval?
So there is very weak, not great evidence that shows that it's beneficial. So there are several studies. Overall, they're suggesting there may be benefits. I'm not totally convinced, but I certainly wouldn't tell anyone not to do it. And there are a lot of people that are believers in it. So I think the data is up and coming, but it's not quite there yet. What is there? Apparently, iodine will rejuvenate your ovaries. I just saw that in a study recently that said that women that supplemented with iodine who had weak ovaries actually did way better. So now everybody's going to flood out there and buy iodine. But yeah, apparently iodine is the way to go. And now that we know that vitamin A, like derivatives like isotretinoin, which is Accutane, is really great for sperm, I have to look up whether or not it's good for ovaries too, because you never know. You might see a bunch of women pile onto iodine and Accutane and see things get better.
Is 40 too old, Dr. V?
In honor of my beautiful, stunning wife, who gave me the fork finger on Instagram the other day. Right. And if you haven't seen that post, please go look at it. I would never, ever say to anybody that 42 is old. But from a reproductive age standpoint, it's at the almost limit of where it starts becoming very difficult to assist you. So I don't think you're old at 42. I think from a reproductive standpoint,
just 40.
Oh, 40.
40.
I think from a reproductive standpoint, it starts getting more challenging once you're over 38 and certainly over 40, and then over 43. It's really difficult. Yeah.
Red light therapy.
Yeah.
And hyperbaric chamber. What are your thoughts? They seem not well studied yet for adeno or infertility, but can it hurt?
It can't hurt. And there is actually increasing data to support the use of hyperbaric oxygen therapy. In fact, Tarek should have a video coming out shortly on that, because we're making one. I have the script for it. Maybe we could do that on Monday. So yeah, there's no question that there are very significant benefits to hyperbaric oxygen therapy. Red light therapy is more questionable, but there's no question that HBOT, I think HBOT, is actually probably very beneficial for a variety of rejuvenative techniques: hair growth, skin health, your joint health, muscle growth and development, brain function, cognitive function. And yeah, it looks like fertility might be beneficial too. I gotta move this over because it's killing me.
It's always one of those things where I'm like, is it too close? Is it too far? Where is it? All right, Dr. V, you ready? Here's another one.
I'm ready.
I guess a comment that serves no real purpose, but I'll read it anyway because everybody gets their moments.
Yeah.
They get their fame today.
Yeah.
One apple a day keeps the doctor away. It continues.
Is that from my kid?
This is from Mickey.
From Mickey. Okay.
Yeah. Followed with the punchline, if you will, if you're ready for it. One clove of garlic a day.
Yeah.
Keeps everyone away.
As someone that frequently eats that white tzatziki sauce or whatever it is that comes with Lebanese food, garlic doesn't keep people away. Like, I eat that stuff left, right, and center, and they're still talking to me. They may not like talking to me, but they're still talking.
They're committed.
To me.
They're committed. It is a high level of commitment.
Yeah.
Hello, doctors.
Oh, yeah. I love that you love that.
I love that. And I love it because you also love it, because they're also acknowledging you.
It's a nice feeling.
Right?
It's a good feeling.
We're both doctors today.
We're both doctors
today. Yeah, I like it. Do grade 4 BC embryos have a chance at live birth, or is it even worth freezing?
Oh, God, totally worth freezing. Very decent chance of becoming a good embryo and a live birth. Yeah. We keep all our BCs.
Still like this. Hi, Dr. Victory. Could you share the benefits of doing PGTA testing in-house instead of sending embryos to Cooper? Since Cooper has been used for years, wondering if any advantage to doing it in-house.
Yeah, advantages are less likelihood you're going to get a no response. Adam has had almost zero failures to detect the DNA. I had a patient today who we sent out, and 3 of the embryos came back with insufficient DNA, or inability to report. So Adam has actually figured out how to use the equipment we have better than the company that made the equipment did. He is a very gifted young man. So we are super excited about the program. There are no advantages to going to Cooper. So we're really excited about having it in-house now. Yeah.
So, not going in order here,
Okay. You're
but
cheating.
I had to acknowledge the acknowledgement.
Okay.
All hail King T and Dr. V. All hail.
Very nice.
Hail
yeah.
indeed.
Hail indeed.
Hail
Yeah.
indeed.
It's going to be hailing outside soon.
Yeah, I'm worried about that. DIE in USL.
Deep infiltrating endometriosis in the uterosacral ligament.
Bravo. Sir.
Good, eh?
Bravo.
Yeah.
This is great.
This
is great.
Yeah.
PCOM.
Okay. Polycystic ovarian morphology. Yeah.
AMH26.
Woo. Good job.
Doctor wants me to do Vizan 4 weeks before ER plus
Yeah.
transfer better for me. Or do you suggest Lupron and no suppression before ER protocol? Thank you.
So studies do show that Vizan for 12 weeks prior to a egg retrieval is beneficial for your outcome, but it included people that did fresh and frozen embryo transfer. So the majority of that benefit is going to come from the impact of the suppression on your fresh embryo transfer results, because it's going to keep your endo quieter as you go into it. It will suppress you a bit, but there's nothing wrong with using it. So I support that. From the standpoint of people who are approaching this with the intention of using Lupron before a egg retrieval, for the love of God, don't do that. That is proven detrimental. No one should get Lupron before a egg retrieval unless you're doing microdose Lupron. But if you're getting like Depo Lupron before an egg retrieval, your fertility specialist hasn't read the studies. So it's harmful. Don't do that. Please don't do that. I beg you, don't do that.
I feel you need to adjust your mic still.
Still adjust the mic.
Yeah, just take it off the thing. I think the shirt's not giving you the support you need. Yeah, and just have it clipped like that. No, just put on your shirt. Just
just clip it.
Yeah, just clip it.
How's that? Or closer. How's that?
I don't know. They're not.
Let's see if that's better.
They're lagging on the responses. Every once in a while, someone says something, but no one's just. The commitment is weak on microphone feedback on TikTok. We're reading the comments, guys. We're trying to make it great for you. Anyway, continuing on. Excited to meet you with December 28th.
Woo!
To discuss IVF.
December 28th?
Marked in the calendar.
Wow. Who the hell made me work on December 28th? I'm going to kill somebody.
Well, now you know. Yeah, usually you don't have that, right?
Great that I'm finding out on my own show that I'm working on December 28th. Well, I'm excited to see you too. I guess I'm working December.
It's got to be something else. But there's more to it. I'm 43, had cancer last year, 2 IUIs this year. Would you recommend going back on Megace while we are waiting to see you? If so, how long?
Oh, you had endometrial cancer and you were on Megace. Yes, I would, unless you've done something to reverse the risk factor. So for example, if weight's a risk factor and you've brought your weight down, it's possible you could avoid it. If it's related to anovulation or oligoovulation and you're taking letrozole, then you don't necessarily need it. But otherwise, yes, if you're still struggling, you should be back on Megace.
Does VRC close over the Christmas break?
VRC doesn't close over the Christmas break, but the lab shuts down for a week so we can clean all the equipment. It's the only time in the year we shut down. Yeah.
Dr. Victory.
That's me.
Treatment naive, just completed first egg retrieval, unexplained secondary infertility. What typical first line transfer protocol?
Letrozole for sure. We use letrozole as our first line transfer protocol. We use, lots of supplements. We use a ton of progesterone, both vaginal and injectable. And we definitely focus on making sure that you get a good thick lining and then proceed with, kind of the optimized embryo transfer protocol. Now, keep in mind that we have a very holistic approach. So we're using a lot of supplements, way more than most fertility centers do for our endo or PCOS patients. We do a lot of microbiome testing. We do a lot of immune testing. So we're not just the kind of do the same thing over and over again clinic. In fact, we're the opposite of that. We're the never do the same thing twice clinic. So we do find that there are lessons that can be learned from each cycle, and we'll improve on that. And we very, very much focus on individualizing care for each patient so that you're getting the care that's appropriate for you rather than the care that's just in general there.
She goes on to say that her dates might be wrong. So maybe you're not working.
God, I hope not, but I might be. I don't know. We'll see.
No, the first thing you do when the show's done is you're going to go look it up.
I'm going to need to look it up. I don't know if they installed the app for my calendar. Oh, there it is. Yeah. You do you and all.
Okay. Hello, doctors. Is it normal for cholesterol and liver enzymes to go up in pregnancy? If so, by how much? And when should I worry? All my levels were normal pre-pregnancy. Thank you.
It's totally normal for your cholesterol to rise because your baby is using your cholesterol to produce its hormones. So that's very normal, but it is 100% not normal for your liver enzymes to go up. That can be a warning sign, for very catastrophic outcomes. So you need to see your doctor right away. Yeah. Or even OB triage right away. Liver enzymes going up can be a sign of fatty liver of pregnancy. It can be a sign of cholestasis, which can have an impact on the fetus, or it can be a sign of severe preeclampsia and HELP syndrome. Any of those, you need to be seen immediately. Please go get seen.
My doctor wouldn't budge from using 350 Menopur and 150 follow stim. So we got a new doctor.
Yeah, so 350 of Menopur has, what is that? That's sevenfold? No, six. Yeah, sevenfold. So that's 7 vials of Menopur, which is 91 units of HCG. That's enough to cause the small eggs not to grow. So anyone doing that is not aware of the impact of the elevated HCG levels causing follicular atresia on and apoptosis on the smaller follicles. So that might just be an education issue, but they're not doing the right thing for you, for sure.
We are considering donor eggs.
Sure.
Better fresh or frozen?
Always fresh.
We would be happy with one child.
It's still going to give you a better result fresh. For the amount of money it costs to buy frozen donor eggs right now, you're way better off buying fresh because, well, not buying, but getting a fresh donor because you're actually getting way more eggs with a higher chance of success. So like that's the right way to go for sure. No question.
Hello, amazing doctors.
Hello back. I know you love that.
We became amazing doctors together. Thank you so much. Currently 8 weeks pregnant. Congratulations.
Yep.
From a medicated FET.
Very good.
Should I stop estrogen and prog at the beginning of the 12th week or at the end of it?
You need to talk to your doctor. I would never tell you what to do. So that's something you need to talk to your doctor about. In our program, we stop the injectable progesterone when they hit the 12-week mark, and we continue the vaginal at half the dose. And then the estrogen, we wean off by, 1 milligram every 3 or 4 days. That's in our program. You need to talk to your doctor. So I can't tell you what to do unless you're our patient.
Great question.
Is the audio better?
No, nobody's saying anything. I don't know what to do with that. Hi, doctors. Again, we saw your post,
Yeah.
maybe my post, maybe your
Maybe
post.
my post. Yeah.
We don't know
We
who.
share posting.
That's right.
duties. Yeah.
That's right.
Yeah. Yeah.
On receptiva not being a good indicator for endo.
Mm-hmm.
It's true.
Yeah.
We did share that.
We did share that. Yeah. Yeah.
But what happens if you get a high score?
Yeah.
Just straight to suppression, or per your other post, just do immune protocol?
Oh, no. The other post was not trying to indicate that anyone should just do the immune protocol. In fact, we've figured out several things that work really well for endo patients, and it's part of our endo protocol, but it's a part of our endo protocol. So our endo protocol includes suppression plus minus surgery. It includes natural approaches. It includes high dose progesterone because you're progesterone resistant with endo, and it includes an immune protocol. So we have all of that built into the one protocol. And when you see me putting up all these posts with people saying, I got pregnant after years of failure, and I think the most recent one was 7 failed embryo transfers, that's what they're following. They're following our endo protocol. The new post was indicating that scientists are starting to realize that it's not just the hormones that are causing the endo. In fact, it's not the hormones that are causing the endo. It's actually the immune system failing to address the endometriosis because it doesn't recognize that there's a problem. I think the endo is very good at kind of being a shadowy actor and hiding so that the immune cells can't find it and can't deal with it, or maybe sending signals out that say, leave me alone, or become dysfunctional or whatever. That's what is going to be probably the next target for endometriosis. It'll probably be a combination of things that quiet the estrogen feed, so the endo starts to starve a little bit, and then strengthen the immune system to attack it. That's what we do during our endo protocol. I knew that ages ago, and that's why we crafted the protocol we have. It is not sufficient to just handle the immune system or to just handle the hormones. That won't work for you.
Question from Instagram. Hi, doctors. This is getting pretty
They're
good.
like,
we're
practically
in the zone today.
You practically deserve a degree now.
It could be the shirt.
It could be.
It could be the shirt. Any benefits of taking creatine for fertility, either egg retrievals or FETs? Thanks.
Not that I am aware of. Didn't we look that up last week?
I feel that was literally last week's question.
I think we looked that up last week.
And something about, yes, it was of benefit, but I'm not going to vouch my doctorate on it. That would be ridiculous. I'll let you search it up.
Oh, here we go. Thank God for consensus. I love consensus. The response is coming. While creatine shows potential benefits for fertility, especially in males, direct evidence in humans is limited and more research is needed.
That's what I said.
They break it down into 2 studies which said yes, 2 studies which said possibly, and 1 study which said no. So I don't think we have the answer yet.
50-50.
Yeah. It can improve sperm motility, energy metabolism, and fertilization rates. But it was in mice.
Do you think it's necessary to quit caffeine for an FET?
No, but as a woman, you should not have more than 1 cup a day, 1 caffeinated beverage per day.
Is that while pregnant, or is that always, or that's once in a while, or
leading up to the transfer and then through the pregnancy? It's a higher risk of miscarriage when you go over 1.
There we go. What level of estrogen needs to be before FET if progesterone is 30?
Believe it or not, no level of estrogen has ever been demonstrated to be critical to success. There's 1 study we reviewed a long time ago that said you needed 100 picomoles, which is like really low, but there's no study which has actually said you definitively need this level in order to achieve success.
Interesting question coming in from TikTok.
Okay.
I'm going to be 2nd time sero.
Oh, cool. Thank you. We love you for that.
They said they found fluid in one of my tubes after a tubal, but said it's okay.
100% not okay. 50% reduction in your success rate. Do not do it. Get the tube removed. Can't do it with the hydrosalpinx. 50% reduction in success. You were literally going through torture with all those shots, the medications, the anxiety, the stress, and all of that for a half chance of what you would normally get. And if you're in an average program, your success rate is going to be about 50%. So you're going to get a 25% chance of success. That doesn't make any sense.
Does any aneuploidy embryo survive?
Yes. This is complicated. So a true aneuploid whole chromosome embryo has a 0.7% chance of becoming a normal baby. That's from the Barad et al. Study in fertility and sterility about, I want to say 2 years ago. A segmental aneuploid has a 26% chance. A high-level mosaic has about a 34%, 35% chance. A low-level mosaic has a 50 or higher percent chance of becoming a perfectly healthy, happy, normal baby. So it depends on what kind of embryo. A complex abnormal embryo, based on the research, it's 30%. We've done some in-house testing. It looks like it's actually much higher than that. So I think it depends on your testing platform, but what we are getting is actually quite strong.
Do you decrease estrogen and increase progesterone in 5-6 days before FET?
Do I increase progesterone and decrease estrogen? Is that what it asks?
Do you decrease estrogen and increase progesterone in 5-6 days before FET?
No, we start your progesterone and we keep your estrogen the same. You don't want to be fluctuating your estrogen. Occasionally, if the lining gets too thin from the progesterone, we'll bump up the estrogen, but we never decrease the estrogen and bump up the proj. We start the proj, which gets it to go up. And yes, of course, we'll increase it if it's not high enough because we actually track those levels. That's why we get such high success rates.
I am currently following your endo protocol.
Awesome.
When do we stop the supplements, before or after transfer?
Never. Don't stop the supplements. Don't stop the supplements. Just stay on them.
That's a song you do. Don't stop.
Don't stop till you get it.
Yeah, that's right. That's good.
Yeah.
That's pretty good. We got it. Hi. What are your thoughts on acupuncture while going through transfer process?
If it de-stresses you, it's beneficial, maybe. If it stresses you, it's harmful, maybe. If you're neutral to it, it's probably neutral. So some people enjoy it and it's great and they should do it. And other people hate it and don't like the feeling and they shouldn't do it. I can say that having once become a porcupine from an acupuncturist whose hands are just absolute heaven. I love her to bits because she saved me literally from weeks of agony. And my son too, Natasha, I don't know if you're watching, but I freaking love you. It isn't the greatest feeling. I mean, she was shooting me with massive needles. They were big and they hurt like a you-know-what. So it felt horrible, but within 20 minutes, she solved the problem that 5 other people could not solve in 3 weeks.
Impressive.
It was unbelievable. And I sent Nassim, my son, all the way from Windsor to Sarnia to go see her because he had agonizing back pain. And within the same amount of time, by the time he got back home, he was cured. He was like, yeah, it's gone. My pain's better now. She is so good. Like she's some sort of,
she's in Sarnia?
She's some sort of traditional Chinese medicine wizard. And she's the sweetest lady. Like I love her. She's so nice. Yeah.
I think we have a new viewer.
Okay.
Because the intro is kind of weak.
Okay.
You tell me out of 10 what you give this intro.
All right. Yeah.
No biases. So of course there's no king or Lord Tarek or anything of that derivative. That's gone for sure. But it starts out with the high both.
High both. Okay. It's a little weak. I get it. But all right. All right.
Yeah. Very weak.
Yeah.
I believe we need to improve on this.
Improve on it. Okay. Yeah.
I have mild isthmusio.
Uh-huh.
Which always has fluid in it.
Yeah.
Having it fixed next week, do you see much improvement after repair? And how much improvement in pregnancy rates?
Yeah, the data actually shows a huge improvement in success rates and pregnancy rates. But I now routinely recommend you also get your microbiome checked, because we know that women with isthmial actually have dysbiosis as well, because the menstrual blood that gets trapped in the crevice, it stays there, and that's just a great nidus, like a focus for bad bacteria. And we know that women that have isthmial have higher rates of adverse bacteria, so that's a no-brainer. Get your bacteria checked, and not with Emma Alice, please. Use a proper PCR test. Theirs doesn't work.
If someone has endometriosis, is Lupron prior to a transfer beneficial to have a successful transfer?
Not by itself. By itself, Lupron is proven useless. But with letrozole, there's 3 separate studies that show that it's beneficial. And certainly in our hands, that's all we see is success after success after success.
What are the success rates of IVF with stage 4 endometriosis, age 25, AMH 0.7?
Ooh. Reasonable, but not ideal. And I don't know if you're nanograms per mil or picomoles per liter. If it was picomoles per liter, that would be a real problem. If it was nanograms per mil, you have a little bit of a chance we can still get some eggs. You would then need suppression, surgery, cleanup, fix everything, all the immune protocol, all the supplements, our whole endo protocol, and then you have a chance. But that's a tough case. 25 years old with very weak ovaries, it's not going to be easy. I'm sorry.
What age limit for egg retrieval that you'd recommend?
Well, we're about to embark on our IVM program, which should solve the problem of the age limit. So we're actually going up to 50. But routinely, I tell people that over the age of 43, it's very, very difficult. And over 45, it's almost impossible. It's extremely difficult by that stage.
Can PCOS cause light periods? My periods are lasting only 1 day. I'm 25.
Yeah, sure, because you're not ovulating. So it's not a period. It's a breakthrough bleed. That's not a period. Unless you're ovulating, you're not having a period. You're having breakthrough bleeding, which is actually dangerous, because what that means is the lining is getting so thick that the upper level of it, like where the 2 upper bottom kind of levels meet, is becoming unstable enough that it sheds a little bit. And that's where you get the 1 day or the spotting. And that base part of it is actually becoming abnormal, which is either precancerous or cancerous. So that is not a safe situation. So make sure you are ovulating. You got to be on either birth control to protect you, or you need to be on letrozole to keep you regular. But you cannot go through your life with those irregular periods. Very, 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 very risky.
Dr. V, how can we prepare for an FET?
Diet, exercise, no smoking, no drinking, no drug use. Get your weight down if it's too high. Get your vitamins up. Improve your nutrition. Take tons of supplements, and then yoga, acupuncture, pray. Make lots of love, because that's important to improve your implantation as well. And then go for it.
Hello, doctors.
Back to something you appreciate.
Yeah,
You can deal with
I
that.
can deal with that. Absolutely. That seems like a reasonable way to introduce.
Yeah.
For a modified natural cycle, FET is cetrotide absolutely necessary? Is ovulation not beneficial for the formation of the corpus luteum?
Yeah. Yeah, so it is, because there's some evidence that reduces preeclampsia, which is like beneficial. There's no question. But from the standpoint of modified natural, there's no evidence that modified natural requires the corpus luteum, or that modified natural has a higher rate of preeclampsia than a natural where you release the egg. So we don't use it, because what I found or find is that if you allow the patient to naturally ovulate, you then have to chase the progesterone levels, because now they're naturally producing progesterone and you're giving them progesterone. And so initially it overshoots, which is not good. And then it kind of crashes, which is also not good. And so you're constantly having to test and play catch up. And whereas when they don't do that, they don't ovulate, you're good. Did we get something screwed?
You're good, kid. Yeah, it's really good. So there was a question. Maybe it's just my phone then. Question is, I was told your office won't transfer aneuploid embryos.
Well, we just transferred a complex aneuploid yesterday, a complex abnormal. We won't transfer a true aneuploid. So if it's like a plus 16, I'm not transferring that. There's no point. It's got a 0.7% chance of success. I can't, in good conscience, charge you whatever it's going to cost to give you a 0.7% chance of success. That's unethical. But if it's over like 15, 20%, sure. So we'll do it when you have a reasonable chance, but I won't do it for 0.7% chance. How can I justify it? That can't be justified.
My naturopath put me on DIM to lower estrogen while trying to conceive. I have endo.
Apparently it's helpful. I haven't dived into that research yet. I'm just about to, but apparently it is helpful. So there's nothing wrong with that. To be honest, guys, there's probably a cap on how many supplements and things you can pour into this. We're already like getting very close to that cap. We're already taking a ton of meds. We encourage people to take a lot of supplements. There's like 9 when you have endo and you're going into an FET. I don't know that taking 10 makes sense. Like we may be reaching a saturation point after which you're actually harming the patient. So we have like a reasonable cocktail, but I don't think it necessarily makes sense to go above and beyond that. There is an upper limit. I had a couple where he was on everything under the sun, and we actually told him to stop using so many vitamins, and they made way better embryos than they ever had before. So I know for a fact in the guys it can be damaging. There's no way it isn't in the women too.
Dr. V, my doctor wouldn't recheck my insulin resistance because he didn't know how to interpret the results. Real comments.
You need a new doctor. I don't know. I mean, even if your doctor didn't know, and I certainly don't know everything by any means, you reach out to your colleague and you say, what do I do with this? So I don't know how they wouldn't know.
And she follows up with, knowable. I want to check it because I'm 8 months postpartum and no cycle has returned.
I don't know where you are, but come see us or contact us.
This is Chels.
Oh, Chels. Oh, Chels, just contact me. I'll tell you what to do, honey. That's easy.
Thought I should do an intro.
Chels, I can help. Yeah. Are you still breastfeeding, Chels? Because if you're still breastfeeding, that's not going to fly. You're not going to get your cycle back.
Thoughts about this recent trend of people's opinion about IVF being immoral or unethical?
Didn't know that was a recent trend. Quite the opposite. More and more people are doing it all the time. Listen, for people that are concerned about IVF being unethical or immoral, there are ethical ways to do IVF. So you can do IVF with one egg. If you're worried about freezing embryos, we can do them one at a time. You can do natural cycle IVF. You can't tell me it is in any shape, way, or form substantially different than doing IUI, and it massively increases your chances. So there are very religiously, philosophically, spiritually, whatever way you want to look at it, ethically respectful and compliant ways to do IVF for the patients that are worried about having too many embryos. We actually desperately need to create a video on that. We really do. That's good. We got it Monday.
Monday we're having a party.
We're just going to be here all day.
We're just going to hang out.
Yeah.
Dr. Victory is an absolute incredible and ethical physician. The Fearless team loves working with you.
Oh, Fearless. Okay, so anybody that's watching, Fearless, phenomenal egg donor surrogacy agency. Hello, my friends. I love you guys. You're the best. And I'm super excited to be doing some more work with you guys in the near future. If you guys who are watching online have not checked them out, phenomenal company. Love them to bits. Definitely one of our go-tos. Great company in every way. Yeah.
Doctor.
And thank you for carrying our baby.
Doctor.
Yeah.
I have 2 IVF failed and 2 miscarriages before going through IVF. I have 0.37 AMH. I'm 40.
Well, first of all, I'm sorry you've had failures. I know that's difficult to endure. I think you need to use that Fortune app and calculate it for yourself. In certain circumstances, the chances of success are very close to zero, and you have to ask yourself if that's worth it for you or not. Or speak to someone who's honest about your chances and figure out what they are. So, just to give you rough math, and you should watch our embryo math video, which was the primitive version of the Fortune app on YouTube. But just to give you a rough idea,
Maybe
right?
we designed it.
We kind of, yeah, we were the impetus. So embryo math is really important. Calculating what your odds are going to be, right? And now AI can do it for you with this Fortune app. But regardless, here's what you need to be able to understand. At 40, 80% of your embryos will be genetically abnormal, which means you need to give me minimum 5 embryos, blastocysts, day 5, day 6 embryos, in order for you to have one, which is normal. That's 1 out of 5, which is 20%, because 80% are going to be abnormal. So 4 will be abnormal, 1 will be normal. So I need 1 out of 5. In order for you to get 5 blastocysts, you need to start with 10 fertilized eggs in an average lab. Maybe less in a great lab, maybe more in a not great lab. But overall, you're looking at needing around 10 fertilized eggs. And in order for you to get 10 fertilized eggs, you need 10 to 13 eggs. Now, even if you optimize all of that stuff, get better success rates everywhere, you still need to start with 10 eggs. 10 eggs is maybe going to get you 1 embryo, which at 40 years of age has around a 40% chance of becoming a live birth. So you actually need 3 of those embryos to get a relatively high chance of success, like 95.2 to be specific, in which case you need to start with somewhere near 30 eggs in order to be successful. So if your AMH is so low, you're only making a couple of eggs at a time, you're looking at doing 10 rounds of IVF. There's nothing wrong with that, except that most people would be bankrupt trying that. So people don't understand what goes into it, and they get very hopeful that they're going to be the one that's going to bust all the odds and do better. But unfortunately, that's just not reality. It's not fair to you, and you need to know the truth. So that's kind of why we have this show, is to tell people the truth. You need to know your numbers, and the numbers are difficult for sure. Are there alternatives? We're working on it. That's what our whole IVM program is, but it's very, very difficult to make it work with conventional IVF at that age. I'm sorry.
What vitamins are highly recommended for IVF?
Your prenatal, fish oil, vitamin D, coenzyme Q10, and then we use melatonin. They're not all vitamins. Some of them are supplements, but that's what we use as our entry level for anyone doing IVF.
Somebody's asking, are you actually in Windsor, Ontario?
I am actually physically right now sitting in Windsor, Ontario. Yeah. Yeah.
If someone has endometriosis, is Lupron prior to transfer beneficial to have a successful transfer?
No, not alone, only with letrozole and a host of other things. But by itself, no, proven actually to be useless or detrimental. So don't do that.
Audio is better, Dr. V.
Oh, good. Thank you. Maybe even this way, so the mic is up more. There you go.
There you go.
Yeah.
How would I know if I have hostile cervical mucus?
I don't believe in hostile cervical mucus. That's something that the influencers try and talk to you about. So that's not really a thing. But if your cervical mucus is very thick, you could see a gynecologist and we could kind of tell you. That could be hostile in that sense because it's preventing sperm from getting in. Like the thickest mucus I ever saw, it literally took me over an hour to clear out, was in a patient who had cystic fibrosis. I mean, it was impossible to get that out of there. It was like cement. So those patients have very, very thick mucus. So if you have that kind of thing going on, yeah, it's going to be problematic. So a gynecologist with a Q-tip can tell you how bad your cervical mucus is. From the standpoint of, are there ways to correct it? Like they talk about that guaifenesin, which is called Mucinex. That's about the only thing we know of that might work. And it's not data driven. There's no studies on it.
One of my favorite questions, Dr. Victory, is where do I send in my questions?
Instagram, YouTube, Facebook, X, and TikTok. Okay. And Tarek just picks them as he goes. But he does like it when you call him King Tarek. All hail King Tarek. Dr. Tarek. All hail Dr. Tarek. Yeah. Yeah.
Continue.
Yeah.
Yes, indeed.
Yeah.
I think that's only normal.
It's pretty normal. I need everybody, because my wife's gone bonkers that I posted her, to go right now on Instagram, if you haven't already, and make lots of comments on that post that Wendy's in, where I asked her if she didn't eat the dragon fruit because she thought it was cannibalism. She's so mad that I posted her. So please go on there and, say lots of wonderful things about her. And then maybe I want to get her on. Plus, while you're on that post, what I need you guys, because I want to get her on the show. I want to interview her about what it's like building a fertility company with a husband that doesn't stop working. And Tarek's in favor, I'm in favor, but she is like so camera shy and very private, and she does not want to do it, but I want to get her on. So all those of you in favor, lots of love right now, heart, smiles, thank you, thumbs up, whatever, tell us. And I want to get @_Wendever on the show as soon as possible. So hopefully we can achieve that soon.
I think that would be a great podcast where I interview the both of you.
Yeah.
That'd be super cool.
It would be so good.
It'd be so good.
Yeah. And we'll make it funny. Yeah.
Got a lot of likes coming for it.
There you go.
Just so you know.
Yeah.
When is surgery recommended and not recommended with endometriosis?
Always recommended. That's easy.
What are the chances of conceiving naturally with an AMH of 6.5 picomoles?
AMH does not predict pregnancy. It doesn't even predict fertility success. It is a terrible predictor of outcomes. It does not predict pregnancy. You can have a rock bottom or a sky high AMH. Doesn't predict your outcome. So don't use it to predict outcome. And I can't tell you, there's no information in that question. Age, BMI, sperm quality, doesn't tell you anything. I can tell you you're going to produce fewer eggs if you do an IVF cycle. Sure. But that's all I can tell you from it. AMH is not a predictor of pregnancy. So don't use it for that. And don't let anyone push you into treatment based on your AMH, other than if you want 2 or 3 babies. So I talked to several couples in the last 2 days who said, we want 3 kids and their age is 37 and their AMH is low. Okay, yeah, you need IVF. I hate to say it, and I don't want to push people into treatment, but they need IVF. I'm not going to get them 3 babies trying something else, because they're going to run out of time and their AMH is going to hit rock bottom sooner than normal. But for anybody else who doesn't necessarily want 3 kids, they want 1 child, or they're willing to start with 1 and wing it for whatever else happens, AMH is not going to predict your success. So don't use it to determine what kind of treatment you're going to get.
So remember earlier, I introduced a question.
But I said it was
Hi both.
Yeah.
So Hi both is back with another question.
Okay.
It's not the question that was next in line.
Yeah.
But it caught my attention. Hi Kings. See? I do it for the both of us.
See how that works? Yeah.
See how that works?
Yeah, I love it. See how that works? Tarek is all in on this. Don't worry, folks. We safely deflate his head at the end of every show. Yeah. Little angiocath up the back, sometimes in the ear.
It's all gone.
I need a balloon where I go.
Yeah. Well, now it's a plural king, right?
Kings, yeah.
So now even you, I see a little bit of.
In the past though, the kings used to fight each other.
No, not here. This is a peaceful kingdom.
We're peaceful kings.
This is a peaceful kingdom.
You're on your little hill.
That's
I'm
right.
on my little
We got good hills. We're not worried about the rest of it.
All right.
So high kings, of
Hi,
course.
King. Yeah.
Stem
Love it.
cycle planned.
Yeah.
450 gonal and
No.
louvers
No.
starting day
Stop.
6. Is that gonal dose too high?
Way too high.
For 56 kilograms. I'm slow responder, so usually need high doses.
Your weight's probably too low, depending on how tall you are. Gain fat, and you won't be a poor responder. Number one. Number two, that's way too high a dose, and I don't know why you'd start Luveris on day 6. That doesn't make sense. And none of the studies have been done that way. And number 3, you're barbecuing your eggs and spending a lot of unnecessary money. So please, for the love of God, don't do that.
Just looking for more kings.
You're so spoiled by my
Just wanted to
by
see.
our audience.
Just
yeah,
wanted to
like,
see, you know.
Yeah,
Just wanted to see
It's
because
going-
I didn't want anyone to feel left out. Like they gave me the intro and I didn't ask their question. I'd feel guilty about
then
that.
you'd really feel guilty.
Yeah, I'd be like, oh, don't worry,
Yeah.
my people, I got you.
There you go.
So
there you go.
no need to worry. Dr.
I gave Tarek his birthday present. I was delayed, by the way. I'm sorry. Last week, Tarek was here on his birthday. Huge round of applause for Tarek, who literally spent his birthday doing fertility fact or fiction. I love this guy. And tonight I finally got him his present. Did you like your present?
Love.
It's cool
You know
present.
what? I might take a picture of us together, post it on IG, tag you in it. You know what I mean? Have a little fun with it.
Nothing wrong with
It was
that.
nice. Hi, Dr. T. Oh man, the compliments. Thank you, my people. Hi, Dr. T and Dr. V.
Yeah,
Again, equal.
I know.
For
I
the both
see.
of
I
us,
see that.
right?
Yeah.
How do you test for endometriosis?
Laparoscopic surgery.
I've completed my cycle monitoring.
Yeah.
Would you know from that process? And what should I ask for at my next appointment?
You won't know unless you have a cyst of endometriosis or you're doing like a Sugo kind of ultrasound, which Dr. Leonardi in Hamilton does, which can sometimes detect endo, but otherwise you won't know. There's no way easily to know if you have endo or not. So deep infiltrating endo, sometimes they can see on ultrasound or MRI, and certainly endometriomas, anybody can see with ultrasound or MRI. But superficial endo, you're not going to know. And it still has a negative impact on your success. So laparoscopy is the true test of endometriosis.
9 o'clock.
Yeah. There you go. Yeah.
And I'll give you one last question.
Tarek's terminal question.
I think it's a good one.
Yeah.
Usually it's not questioned this way. So I feel this is a good question for everybody. What does a BMI of 42.9 do to men and their fertility?
Annihilates the sperm. Horrible for the sperm. Sperm quality is down. Sperm performance is down. Sperm number is down. DNA fragmentation is up. I was just reading a study Tarek showed me earlier demonstrating that your polyunsaturated fatty acids go through the roof and it's highly detrimental to your success in sperm quality. Men who weigh in excess of what they should damage their testosterone levels, their estrogen levels go up. Is horrible. Like obesity is the true pandemic. There's no question about that. And we need to actually control obesity. Listen, I'm the first person to say it. I gained way too much weight recently, and I am taking medication to get myself down. And thank God, knock wood, I lost 25 pounds. You need to control your weight. The idea that it's just fine and we're fat shaming and all, it's total BS. It's absolute nonsense. It's not about fat shaming. It's about helping people achieve the success that they want from their fertility journey and to be healthy while doing it and remain healthy in the pregnancy and remain healthy afterwards. This has nothing to do with fat shaming people. No one should be fat shamed. Totally inappropriate. It should never be done. We're just talking about medical facts related to associations between low BMI and high BMI and your fertility outcomes. And they're terrible. In fact, low BMI is worse than high BMI. So it's not even about fat. It's about your body mass index in relation to your outcomes. And whether you're a guy or a girl, it is not good. It is so not good. So you must take care of your weight in order to optimize your health and your offspring's health. It is a major, major thing. We should have a clip coming out very soon that we recorded last week that literally talks about how your BMI is tied to certain markers and inflammatory pathways that can actually impact the offspring more so than just, what the pregnancy is like and things like that. That your offspring can actually grow up to have problems because of what they're being programmed with as a result of the maternal or paternal BMI. So these are very serious points. It's not like a minor thing and people get all angry about it. Why did their friend get pregnant? Why aren't you treating me? Like, we'll treat anybody, but is it going to work? No. Some people are at a 90% decrease in success. That's me just taking your money. I don't do that. I want you optimized so I'm successful. I don't want to just take your money and give you nothing. That's just me being average. I don't want to be average. And with that, we will end the show. So thank you all for watching. Please make sure you go on the post that has my wife on it. You can see her beautiful blonde head in the
She's
post.
online, by the way.
She's online. Hi, Wendy. Everybody, Wendy's on. So please tell her how much you would love it if she was actually on the show with me, being interviewed by Tarek, and what that would be like, because I think that would be great. First of all, she's totally hot. And second of all, I think she has a lot to offer. She helped me build VRC. She is my other half in this, along with Mara and several others who built this from the ground up. So I would love it if Wendy would come on the show, and Mara too. You're welcome as well. And for those of you who are willing to put up lots of comments, drown that post in comments saying Wendy needs to come on the show. Please, 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 because that would be awesome. And share that clip with every single person you know, and repost it and all that fun stuff so that she'll be forced to come on the show. Thank you, everybody. And if Wendy is watching, I love you, honey. I'll be home in about half an hour.
Yes, Wendy, please come on the show, they say.
That's awesome. Have a good night, everybody. We will be back next week.
Yeah.
We will be back next week. Yes, we will be back next week for Fertility Fact or Fiction. And we'll see you all.